This presentation has been created as part of ESSC 12003, Exercise and Sports Psychology, and will look at the positive and negative psychological effects of anabolic steroid use. Anabolic androgenic steroids, also known as anabolic steroids or juice, are synthetic derivatives of the male hormone testosterone. Anabolic steroids can be taken orally, injected into the muscle, or applied as a gel. These steroids have been used since the 1950s by various athletes, however are most commonly associated with bodybuilders. Acceptance of anabolic steroids has been driven by a cultural shift to have what is perceived as the ideal physique. The International Olympic Committee made anabolic steroids a banned class of compounds in 1974, and therefore they are generally taken during training to avoid detection. However, they are also taken by non-competitive athletes. Anabolic steroids are taken in various ways, such as stacking, or taking more than one drug at the same time, tapering, which means gradually decreasing intake, cycling, or using for a fixed period before ceasing use for the same period and then repeating the cycle, as well as pyramiding, which involves maximizing the usage in a fixed time frame, then minimizing in the same time frame. There are various reasons why athletes take anabolic steroids, such as to increase muscle mass, improve athletic performance, increase muscle size, and improve muscle appearance. Furthermore, they are taken to reduce the recovery time of the athlete, as well as to stimulate aggressive behavior for contact sports. Therefore, it can be said that they are taken to both enhance performance and cosmetic appearance. The consumption of anabolic steroids carries various physical side effects, including infertility and testicular atrophy in men, excessive hair growth and menstrual irregularity in women, premature epiphysis closure, resulting in stunted growth, liver damage, an increase in low-density lipoproteins, and an alteration in cardiovascular function, which may result in a myocardial infarction. A study which was conducted in a group of weightlifters labelled the most common symptoms of anabolic steroid addiction as fatigue, depressed mood, restlessness, anorexia, insomnia, and decreased libido. Other symptoms of withdrawals were recorded as a desire to consume more, dissatisfaction with appearance, as well as suicide. Anabolic steroids are seen to have both a positive and negative effect on self-esteem. The positive includes an improvement in self-esteem due to obtaining an idealized body image. Furthermore, there are many negatives, including muscle dysmorphia. Muscle dysmorphia is a preoccupation with the idea that one's body is not sufficiently lean or muscular, and this is generally based on an unrealistic body type. Muscle dysmorphia leads to a poorer quality of life and a higher risk for suicide. Socio-cultural factors and social media are some of the known causes that influence negative self-esteem and can result in a dependence on the drug. There are some perceived positive psychological effects of anabolic steroids, such as euphoria, enhanced sex drive, improved athletic performance, and an increase in self-esteem. Users in one study have named the most common psychological side effects as an increased libido, feeling more powerful, increase in confidence, and a higher satisfaction with body image. Although most of these are positive, many users are unaware of their adverse behaviors and only see the positive effects. Another positive psychological effect seen is that of an increase in muscular strength and mass, as well as an overall improvement in performance. This allows the athlete to reach personal bests and remain competitive, and may also mean that the athlete is able to keep their spot on a sporting team. Furthermore, it also reduces the athlete's physical recovery time, and this is very commonly seen in bodybuilders and weightlifters. Anabolic steroid users also feel an initial sense of well-being. As well as this, positive mood changes such as euphoria, which is a state of wellness and happiness, and users also see an increase in energy levels. Anabolic steroids cause the release of dopamine, giving users a similar feeling to that of amphetamines. Aggressive behavior can also be seen initially as a positive, viewed as determination rather than aggression. Long-term anabolic steroid users will see euphoria turn to dysphoria. There are also many negative psychological effects of anabolic steroids. These include mood alterations, aggression, anxiety, mania, depression, paranoia, feelings of invincibility which result in impaired judgment, and a change in social behavior. Aggressive behavior is one of the many negative psychological effects and can be seen even after a single usage. Users also show poor impulse control and extreme mood swings. These behaviors are commonly referred to as roid rage. Heavy usage causes a person to become wired, in that a minor conflict will provoke physical and verbal abuse of another person. Usage often results in violent behavior, and research shows it can also result in criminal behavior. Anabolic steroids also trigger passive behaviors, such as depression. This can lead to social withdrawal from friends and family, as well as insecurity related to low self-esteem. This is often seen in those who cease use and see a decline in their strength, and may otherwise be known as a withdrawal. Anabolic steroid users have a high risk of suicidal tendencies. Anxiety is also seen frequently in long-term users. The Symptom Checklist 90 is used to assess several dimensions of anxiety and hostility and the directions of the emotions. Anabolic steroid users often feel negative feelings towards themselves and others, known as an upward-downward comparison, where they are either comparing themselves to someone better or worse than themselves. Anxiety is also linked to muscle dysmorphia and low self-image. Symptoms of anabolic steroid users reflect a disruption in neural circuitry that regulates anxiety. To summarize, anabolic steroids are a banned substance that are a synthetic derivative of the male hormone testosterone. They are mainly used to increase muscle mass, strength, and enhance performance. Anabolic steroids can be seen to have both positive and negative effects on self-esteem. The negative psychological effects suffered by anabolic steroid users outweigh the positives. Short-term use sees more positive psychological effects such as euphoria and increased strength. Long-term users show mainly negative psychological effects such as aggressive behavior, anxiety, and depression. Thank you for listening.